All right. Hello, everyone, and thanks for joining our 9th session of Holding Hands today. And thank you all for joining us today. And if any of you are new, welcome. And we hope to see you next sessions as well as one of our Holding Hands members. And today we have the lovely Dr.Roopa from the Ayurdhama Ayurvedic Clinic that's based in Point Cook. So I will hand over to you, Dr.Roopa.
Thank you, Isha. Thanks for introducing, and I thank everyone. Welcome, everybody. I thank everyone for sparing their precious time during this time, and it's lunch hour. I know we can grab a plate and start eating as well. It's such a wonderful time that she's coordinated such that everybody, whoever is working as well, can join in this session. So I think so that was the main motive. So yeah, good on you guys. I really appreciate the team for collaborating with so many people and getting this organized. It's tough. They're working tirelessly so that we stay connected during this challenging time. So hats off to you guys. Thank you. Also, this is my first Zoom session, but and I don't know my audience well, but I know you all are from varied backgrounds. I've kept my talk pretty simple, concise, and so please feel free to jump in and ask questions, maybe at the end of the session, because that will be more appropriate as per the organizers. So let's try to answer quite questions and then make sure we can, some myths as well. We can try to get that. Yeah, also, I think so. My topic is going to be Ayurveda for women health today. So I have got a few slides here just so that it gets a bit easier for you to relate and also maybe try to see a few, graphics and maybe jot down any questions if you have. So I've given a bit of a concise introduction about Ayurveda and also about a few modern concepts as well, because I'm sure when you visit GPs or anything, you'll be more inclined towards knowing the modern terminologies. I've added a few modern terminologies as well. So I'll get started. Isha, are you happy for me to share my screen?
Yeah, go for it.
Okay.
All yours.
So don't be surprised if you're having a few surprise visitors here attending the Zoom meeting. So the door is closed, but you never know. You might have a few of them.
That's okay.
Okay, I'll just share my screen. Okay, sorry, just give me a second.
That's all right.
Okay, are you able to see my screen?
Yes, perfect.
Okay, let me just expand it and we can get started. Okay, so Ayurveda. So I know most of you are aware about the word Ayurveda, but let me just quickly run you through what Ayurveda is. Ayurveda is one of the most ancient medical sciences known on the history of the universe. So it is an Indian system of medicine and traces back to like literally 5,000 years back. So it's like naturopathy, very similar to naturopathy, but in naturopathy, I guess most of the medicines have been processed, whereas in Ayurveda, most of the medicines are in raw form. So, and according to Ayurveda, which I have studied, like it runs for 5.5 years back in India, and we have a few other courses in Australia as well. So the main goal of Ayurveda is maintaining the health of an individual and at the same time treating a patient or maybe healing a patient, I would say. So these two being the main goals of Ayurveda, it's quite interesting to know how Ayurveda deals, because in Ayurvedic classics, texts, whatever we have, they deal more about prevention. How do we really prevent diseases? They have regimens for daily or maybe even seasonal regimens, which we can maybe try to adopt. I know in this era it's hard to adopt each and everything, but if we take the glimpse of it and try to maybe adopt a few things, we can try to prevent major or maybe quite a few diseases, of maybe 50% or 60% of the diseases we can try to prevent that and stay healthy for a long time. So with this introduction, why women health? I've chosen, why is this differentiation between a male and a woman? I know this when Isha called me up, and I usually initially interacted with Neha, who's my friend, and then when Isha called me and she said, "What's the topic?" And I don't know, it's just suddenly out of the moon. I just said, "Okay, I will for women health." Like it's for this organization, I think it's going to be ideal if I talk about women. Yeah, so here it is. Ayurveda for women health. The first two slides are going to be about my perspective about how Ayurveda can help women in prevention and also in treating a few illnesses related to women health. So next slide. So if you check the health of a woman, you check the health of society, and it's so rightly said. If a woman is mentally, physically, emotionally healthy, then she can support the family and in turn the society. So woman is considered to be the building block of a family. As we all know, we have got, we've been juggling being a careerist and as well as a homemaker. We have got so many responsibilities. So it's very important that we keep up to our health, and that's why women health is considered to be really very important. Yeah. Okay, just to be on the lighter side, I've got another slide here. So if mama unhappy, I'm probably happy. Isn't it so true? I could relate this slide so well back when I was young. That mommy wasn't happy, I'm sure the atmosphere in the house as well would go so down, and we could really sense that so well. Nobody would be really happy. So we never wanted our mummies to be unhappy. And yeah, we can relate it so well now that we have our own families. Okay, just coming to next slide. I know you'll be having a lot of questions, and we'll try to answer a few of them here. So why female health? As I said, women health in the last decade has gained a lot of attention, especially because of the evolving nature of in the society. It's like mainly we've been, like as I said, we've been a careerist as well as a homemaker with lots of responsibilities that we've been dealing with, and that's placing a lot of demand on our health as well. And it's really important that we stay mentally, physically, so emotionally on top to get on top with our work and with our priorities as such. So I can give you a small example. For example, an iron requirement. As we all know, we would have seen quite a few females or maybe patients in my practice that quite a few people are deficient in iron, especially women, because we lose out iron on a monthly basis. So it's a key requirement that we are aware that iron is needed, iron either in the form of a supplement or also in the form of dietary. It's really very important, and it keeps up to our health. So if we are just aware of these things, how a woman health is different from a man health, we can try to cater to its its requirement, and we can make sure we try to stay healthy and away from any kind of major illnesses, because iron deficiency has resulted in a lot of complications of life in women, and we need to try to prevent that if that's possible. And especially being vegetarians, I know it's really hard that we get that amount of iron in our diet, so we might need supplements over time. So yeah. Okay. So just in short, I would just like to tell you that you would have heard the term hormones. When you talk about female health, you have to talk about hormones. And you know that we have got quite a few specific hormones that go up and down in our life, in our body, and which causes quite a few changes. So right from infancy till menopause, we have these hormones playing up in our body. And that's why you see various mood swings, you get all sides of emotional disturbances sometimes, and sometimes we really feel happy, many a times I can say. So we need to really look at these things. I won't be going in detail considering it's just a concise thing, but right from puberty, that's the first time you have your menstruation, to menopause. I'll be taking 3 examples, one for puberty, one for pregnancy, and one for menopause, and how we can really deal with these through Ayurveda. And we can try to help to prevent any kind of illnesses around puberty, pregnancy, and also menopause. So in the next few slides, I'll go through the examples. But before that, I just want to stress on one small point, and that's about the infliction of diseases in a woman. So we always see that there should be some cause for any disease. For example, you see PCOD, polycystic ovarian disease. You take endometriosis or any kind of diseases you know there is a cause, and the cause is quite evident. The doctor will tell you this is the cause for this particular illness. But have you ever seen a disease without any cause? I'm sure anybody who has PCOD, the doctor will say, you've got PCOD, they've got some hormonal disturbance, and that's all. We really don't know what the cause is. So if my next slide is going to tell you about the expressed and the unexpressed part of a woman's health. So expressed part, we've got two organs in our head. That's why it's hypothalamus and pituitary, which control a few target organs like uterus, kidneys, and quite a few organs. So this is the expressed part. So any derangement in any of these organs can definitely result in diseases in these target organs. For example, your kidneys, your thyroid, or your uterus. But there is an unexpressed part. You see in the topmost thing, you see an unexpressed part. That's the emotions. That's the mental status. So any kind of disturbance in this can directly result in, the target organs can get hampered as well. So we need to understand that stress can play a major role in any diseases related to women health. So we need to be mindful of how we manage and balance our work and work life, so that we can try to reduce the amount of stress on ourselves. I wanted to bring up this topic because it's so important that we go through so much, and sometimes it gets out of our control. So it's really ideal that we talk about stress sometimes. Okay, now prevention. Before we go to the treatment aspect, as I said, Ayurveda focuses more on prevention. We don't want to load the patient with lots and lots of medicines, and that's going to sit in their body, and that's not ideal. So the first thing is prevention. What do you do? Balancing the hormones or doshas. Doshas is nothing but it's just they are just three components in our body according to Ayurveda. I won't deal in detail about this, but we can say just balancing the hormones for now. How do you do that? Just being aware. For example, if there's anything wrong happening in your body, if you just see, for example, if your digestion is not good, if your digestion is, you're not unable to digest things properly. So that's the first thing that you have to note according to Ayurveda. So are you able to think, are you hungry? Is it right for me to eat a big paratha at this time? So you just need to start from there. And if you think your body is not, you're not hungry enough to digest that big plate of meal, then I think so you should just reduce or choose wisely as to what you have to eat. So it starts from there. If the digestive fire is not that great, then there will be remnants, there will be undigested food, and that causes toxins according to Ayurveda. So we need to be really careful about what we eat. Not exactly what we eat. You can eat anything if your digestion is really good to some extent. But if your digestion is a bit weak, then you need to really take care of what you're eating. Be choosy on what you've been eating. If it's digesting well, you can really, and you're getting good bowel movements, that's another thing that you have to be very careful. If your bowel movements are fine, if you're feeling hungry at regular times, then you're really healthy. So that's just a criteria. So if you have a lot of toxins, then it can really result in decreased immunity, which is called as OS in Ayurveda. So we have to be really careful about what we eat, depending on our prakriti or depending on our constitution, we can say. Okay, so what Ayurveda can offer. So as I said, 3 examples here: menarche, or maybe menstruation, we can say, pregnancy, the prenatal care, the postnatal care that Ayurveda can offer, and the menopause aspect. So menarche, the first time the woman has menstruation, I know there will be a lot of hormonal changes, and what kind of diet has to be taken. We really have to be very, very, especially during menstruation, the digestive fire isn't great. You've got pains, aches, there is a downward movement of vata. Like, it's like a cleansing that happens on a monthly basis according to Ayurveda. So that's why in the previous, years, that women used to get relieved of a few responsibilities and need to actually rest well. So it was incorrectly taken, perceived as not being going near, deity or something, which I'm not going to touch more. But it was incorrectly perceived as such. But the main idea was for her to rest and rejuvenate. So that was the main idea. So just having simple, easily digestible warm food, making sure you don't suppress your urges like urination, micturition, or maybe even bowel movements. Like, for example, if you get really involved in a meeting and really you're busting, but you're just trying to not go. So that's something like, you're really suppressing your urge, and that's not ideal. What happens is then it causes pressure on the uterus, and then again, you have other issues related to that. So during this time, you need to make sure you're hydrating well. You have a bit of a lifestyle modification. You work from home. Now it's not an issue. Everybody's working from home. But yeah, just try to modify a bit. I know you can't take those 3 days off completely. Neither our partners are going to help us with a complete takeover, but just make sure you take it a bit easy during these 3 days, because we have seen that quite a few menstrual disorders can happen if you really don't, correctly take rest during this time. So we have got quite a few good medicines in Ayurveda which can help regularize menstrual cycles as well. So we have to be careful. Also, I guess women should be a bit mindful about the intake of fat in their diet, because it can cause PCODs, and not just fat, but it's carbohydrates. Because if you have quite a bit of carbohydrates, that can ultimately lead to fat if it's not digested well. So just be a bit mindful of what you're eating during this time, or as a woman as well, if it's early, if it's menarche. Yeah. Now, coming to pregnancy, this is such a beautiful phase of a woman's life, and you feel so, initially you do feel low, especially with the different changes happening, but then it's quite daunting as well at times. So Ayurveda has got absolutely great, not just medicines, but a support way as well for prenatal, that's during the pregnancy, and postnatal as well. So prenatal, we have got quite a few good massages with minimum medicines. We wouldn't really recommend a lot of medicines during the prenatal phase, because we don't want any kind of undue medicines going in your body and also to your kids. So we wouldn't really recommend a lot of medicines apart from the supplements that you've been having. So with yoga, with a few massages, you can really emotionally bond with your baby and feel really good. So in regards to your postnatal pregnancy, care is really very important. I'm sure your moms who have got kids, their parents would have visited them, and they would have got a schedule for 45 days to a month's time or whatever, and they would have said, don't eat this, and you would have felt bad for quite a few times. But it is quite ideal. According to Ayurveda, there are certain regimen that you have to follow, so that you really, your body is unable to digest quite a few things. You're weak at that stage. Otherwise, there'll be quite a few aches around. So appetizers are needed. A few massages would definitely make a huge difference, relieve the vata in your body. And dietary advice, I said, yes, definitely. We've got quite a few good medicines like Dashamula, Rishta, Saubhagya Shuddhi. You all would have just maybe not heard, but yeah, we have got plenty of good medicines which can help a woman come back to her normal self in the postnatal period. So rest is also very, very important. Now, coming to menopause, as you all are aware, we have seen our moms, aunts going through menopause, and it was pretty, we haven't seen major changes, at least I haven't, because we've been so busy taking care of us all the time, and the concept of real menopause issues have just come up recently. And we have seen a lot of hot flushes that they talk about, anxiety issues, mood swings, and heart diseases. All of this can be slowly prevented. We can make. Sorry about the background noise there. Can you still hear the noise?
Let me have a look.
Now it's better.
Can you hear the background noise?
It sounds like a vacuum.
Is that fine? Am I audible and am I fine?
I think it'll be better if the vacuum was a bit off for now, if that is, because we can hear it in the background.
Oh, is it? Just give me a second then.
That's all good.
That's
all
okay.
good.
Okay, is that fine?
Yeah, better.
Okay.
Yeah.
So we're just talking about menopause. So we've got quite a few options here that we can try to prevent the heart diseases or anything that's surrounding the age and the stage of woman in that phase. Okay. So just to let you know, we have quite a few medicines. Panchakarma, I would just like to touch on a few aspects of Panchakarma as well. Panchakarma is a detox therapy in Ayurveda, which is really widely used in quite a few disorders. And the main concept is to actually eradicate the disease from from the root cause. So that's more important according to Ayurveda. So we've got quite a few medicines that I've just listed, but the Panchakarma is like Abhyanga, Shirodhara, a detox therapy which involves Virachan. So it's ideal that at least once a year or maybe once in a few years, if someone can go through a Panchakarma, then it will be ideal for a woman. So recognizing symptoms early and seeing a patient right away increases the likelihood of successful treatment. So just being aware of what's happening in your body and reacting to that is what is needed. Okay. So lastly, I'd like to say that, a healthy and strong female is the base of a society. So she needs proper care, respect, and support from a family to serve better in return. So as you can't serve with an empty vessel. So I just end my talk with this, a slide. Thank you so much. And it was a short one, but I'm happy to go through any questions or elaborate anything that's needed.
I have a question, Roopa. So my mom is going through, as Kajal also asked, I'm sure there's not an exact age of menopause because my mom does have thyroid and she has not even hit her 50s yet, but she's going through like menopause-like symptoms. Is there a way we can, I don't know, you might not have the answer to it, but assist the whole temperature change? That is the one thing that she's struggling with a lot, where she just gets hot very quickly and she gets really, really like overwhelmed. She's like, I just need cold air on my face. Is there anything she can take or do during the day? She does yoga, so is there anything else that will help her with the whole temperature change, or it is what it is?
No, we can try to actually help her with a few other medicines, because the thing is, during this phase there are a lot of hormonal changes, like pitta. This pitta is nothing but heat in the body. It's so much aggravated. We need to get it sort of back in control. So there are certain medicines like Shatavari and quite a few medicines which are just like, you can just mix it in maybe a cup of milk and give it to her.
Okay.
So this will really help, reduce the body temperature and the hot flushes that she's going through.
Okay, cool. And I'll also ask, if you're done with the slide, just stop the screen share just so you can see everyone, and then you'll be able to like interact a bit better.
So I'm just trying to see where to...
Just at the bottom, at the top, sorry, it should say stop sharing. The green bar at the top.
Okay. give me a second. Not that savvy, but
That's okay. Probably press the escape key so you get out of the
yeah.
PowerPoint view. Yep, and then at the top
I
it
can
should
see that. That's
better. Awesome. Thank you for that. I understand there's so many things in Ayurveda that we could go on and on about, but I think you summarized it pretty well. I'll probably just read out some of the questions that are on the chat, and then anyone can jump in if they have any questions. So Kajal's asked, what is the exact age of menopause?
It's hard actually. It depends on the constitution of the person actually. So it's somewhere around, it says 50 to 65. That's what has been stated in the classical texts as well. But in this, era, we have seen quite a few early menopauses as well. But yeah, that's the ideal age.
I know that my mom she started experiencing it at the age of 45. So she's like 47 or 8 now, I think. I can't remember. I should know it. But yeah, so she did experience it quite early. So I think my understanding, like what I learned as well to help her was, I think it can range from 5 to 10 years, right? Like menopause, it can go for a long time, but it can be short time for some.
Yeah, that's right. It can start early. The symptoms can start early because, with the drop in the hormones, it starts early, but then actual menopause happens only after a few years. Yeah.
Okay, cool.
There's also another question from Parul. It says, how can she recover from iron and vitamin D without taking medication? And I'll vouch for it. I'm currently taking 4 pills of iron, 4 pills of vitamin D, and I'm getting an iron infusion next week. So I would like that answer as well.
Yeah. Yeah. Okay. Yeah. Good question. First thing is, in Ayurveda for vitamin D, frankly speaking, I don't think so there's any replacement. The sun or capsules, that would be the ideal thing that you would be taking. Whereas for iron, we do have a dietary plan that we can suggest for the patient. And at the same time, we've got a few iron capsules in Ayurveda also, which can help. It's very similar to the modern medicine, but the only thing is with Ayurveda, we can try to prevent the constipation or maybe the harsh, effects that they have on the gut health as such. So we have got quite a few iron supplements in Ayurveda also. So it is needed for a woman that she tops her iron levels on a regular basis.
Cool.
Also, Parul, I'm not sure if you heard Roopa say this earlier, but she's also taking phone consultations if you want to reach out to her and talk about it more in detail as well. So we can give you her Facebook details. Cool. Nidhi, was there any other questions on the chat?
I think the other question there was that I think Smita said this. Ayurveda always suggests to use milk, curd, and ghee. Here it's mostly hormone-induced milk. Is it safe to use?
I know this is quite a controversial topic, and I wouldn't be able to answer that completely. But what I would say is, yes, these days milk, I really wouldn't trust the source as such.
No, yeah.
But I would suggest rather than having full cream milk, if you could just maybe have skim milk, especially for women, that would be helpful. You're getting some kind of nutrition at the same time. You're not getting a complete package as such as well. So yeah, that would be my perspective or maybe my suggestion.
What about plant-based milk, Roopa?
Plant-based milk, yes, definitely. So I would agree that plant-based milk would definitely help. But when you compare plant-based milk, calcium, the content of calcium against cow milk or goat milk as such, it's pretty less. So you have to compensate that either with your yogurt or maybe a cheese intake. I really wouldn't go for much cheese because that's stagnating according to Ayurveda. Instead, intake of ghee would be more appropriate than cheese.
Okay. I think one question that we're getting again and again, Roopa, is it bad to have menopause early? More like in your 30s. So is it something that they should be, or is there a particular reason behind it of having early menopause?
There will be an underlying reason for
Mm.
that, maybe some kind of illness or maybe surrounding that. So we need to look into that. We can say what happens is once a lady comes into menopause, the hormones go down, and these hormones are actually helpful in keeping your heart and quite a few organs healthy. So once you reach menopause, you're more succumb to a few other illnesses surrounding heart and all that. So if it's an early menopause, then we need to be maybe, the woman has to be really made aware that she has to go for regular checkups so that her heart and other organs are well protected, or maybe any supplements of calcium would also help.
Okay, cool. I think that goes hand in hand, as in once you do experience a lot of changes suddenly in your body, because I think once you give birth and everything, that it kind of have that constant stable health, and then out of nowhere the menopause just hits you, and it's like a really roller coaster. So I think the easiest way is to consult a GP if you're experiencing any causes. The other question that we had, which is, again, Sushma asked a very good question, is that does Ayurveda help in prevention of genetically transferred diseases? And I wouldn't know the definition of that, but I can give you an example of thyroid. I was given it to me when my mom was pregnant. And since then, I was in homeopathy for a very long time. And I'm not, unfortunately, anymore. But does it actually help with genetically transferred diseases?
See, certain diseases are called as curable, certain diseases are manageable. So,
Okay.
when it comes to genetically, genetic, maybe congenital or maybe even genetic ones, then it should be managed. And Ayurveda has got quite a few medicines which can be managed well if they're detected early. So even if they are genetically transferred, though, we do have quite a good few medicines which can manage them pretty well.
Okay, cool. And with Ayurveda, it's pretty much if there is let's say, if I do contact you in regards to, hey, this is my problem, I'm going through this disease or whatever it is it more of a consultation or is it more of a treatment? So do I get in there and is it more like a checkup, like a whole body's been, touched? I don't want to say touched, but like, is there a full checkup or is it more like one-on-one, just a conversation and it's like a carry-on conversation that you have?
No, it's a sorry, it's a complete consultation which involves assessment, first discussion about the issue, and then it's physical examination. It might be, nadi pariksha, or maybe checking the pulse, or even doing a BP checkup, and what all a GP would do, but in detail with an Ayurvedic perspective.
Yeah.
So it's going to be a complete consultation with dietary advice, with a treatment plan. So everything which usually ranges from 30 to 45 minutes. So I make sure I give plenty of time to my patients so that I understand what, some people just come for maybe a rejuvenation therapy, or some people really have an issue and they want to discuss. So it's ideal that the doctor is spending a lot of time with the patient to understand.
So it's more of a consultancy base. So it's like, do you also have like checkups, as in every 3 months there's a
I would suggest, I definitely, or maybe, I've been such a person who calls up patients and say, are you okay? You can just maybe send me an email how you're feeling. So I like to have that one-to-one connection with my patient so that you know what's happening. And if they want to discontinue at any point, they're happy to do that. But if they could let me know, that would be good so that I don't keep worrying about them.
So it's like, okay, so it's not like a one-off GP kind of visit. It's not like one time. It's more of,
I wouldn't. I feel a more regular sort of if there a regular sort of interaction would be really ideal, because it's good to keep in touch even if they don't have any if they're not taking any medicines also. It's good that they keep.
Cool, makes sense. The other, I think the biggest one that I also have, and I think Isha also, and I'm sure hundreds of viewers also have, is cramps and headaches. So recently I've been getting constant headaches, and I'm sure that is because I'm looking at a laptop 24/7 of the day. But is there a way, anything that you can take or anything that you can do except yoga that it can help with your headaches and cramps?
Sure. With headaches, we really need to rule out the cause as such. There are quite a few headaches that we have seen of late. It might be just mere stress. It might be related to your digestion also sometimes. So we need to really rule out the cause. But we do have quite a few medicines which can help. Not exactly painkillers, but try to tackle the issue. Maybe if it is digestion, we can try to, and then we can see the result as such. So it would be ideal if we really look at the patient and look at the root cause before suggesting anything as such.
And I think this goes back to I think Danielle said this as well in one of the comments, that that a woman was diagnosed premature menopause at 25, and that's because she wasn't having regular GP checkups. So having that kind of regular GP checkups and consulting the GP or Ayurvedic doctor would be really nice, and having that consultation really comes in.
Yes,
hand.
yes, definitely.
I think one question that I had is, every Indian parent that, I don't know about everyone else in this chat, but I've had this tablet called Triphala on my table for about every year. It comes in, there's a bottle, and they're like, take it every day. I just want to know what it does.
Okay.
Because I take that every day.
Triphala is a very common medicine in Ayurveda, and I sometimes pop a few pills as well if I think it's not. Triphala is called as a rejuvenating drug. So if you have any issues in regards to digestion, if your bowels are not clearing appropriately, or even if you have hypertension, that is BP, so you could just get it sorted with Triphala. Triphala is such a wonder drug in Ayurveda that when you have combination of medicines, they make sure they add Triphala because it's really a very good medicine. So, but ideally used for your bowel movements.
Okay, cool.
Have it appropriately, 3 to 4 tablets or maybe 5 grams per day. It reduces the cholesterol levels as well. So, yeah, wonder
drug.
My
mom and dad are doing good job.
It's wonder drug, yes, definitely they are.
four dippies of that on my counter, and I'm like, okay, I'm taking one every day. Any other questions, guys? We have Smita saying that she just wanted to share that you have actually helped her with hemorrhoid ovarian cysts. I'm thinking that's how you say it, and she's very grateful for your help.
Oh, thank you so much, Smita, for sharing that in this forum.
Yeah. Any other questions, guys? I'll give you 5 to 6 minutes to just pop off your mic and speak up if you have any other issues. Just wait for
have we done with the questions? I'm going to stop recording just so we can ask if anyone has any personal questions.
I have a question. It's me, Niti. Aisha.
Oh, yep.
Yeah. So I just